Hi there. Welcome to the overview of your medical scheme benefits for 2025, brought to you by NMG Benefits. This video highlights and summarizes the various options available on Bestmed. NMG is an authorized financial services provider. NMG staff are fully accredited with the FSCA, the Council for Medical Schemes, and your medical aid. As one of the largest financial services intermediaries in South Africa, with more than 30 years of experience, we can assist with various elements of your medical scheme and provide you with independent advice on the most appropriate option. In this presentation, we are going to take you through the three main components of your medical aid, provide you with an option summary, take you through the wellness program benefits, and lastly, look at the monthly contributions for 2025. Let's move on to the overview of the three components of your medical scheme: hospital cover, chronic cover, and day-to-day cover. Hospital cover is the most important element of your medical scheme. Hospitalization is unlimited on all Bestmed options. This rate is reflected as a percentage of the scheme rate, and all Bestmed options cover members up to 100% of the Bestmed rate. Planned hospital procedures need to be pre-authorized with Bestmed by contacting the number on your membership card. Your doctor may do this on your behalf or may give you the necessary codes and descriptions to obtain the authorization yourself. Members on certain plans may need to make use of a network hospital in the case of planned procedures. In the case of an emergency event, members must go straight to the closest hospital. It is recommended that members always carry their membership cards with them. It is becoming more important each year to consider taking out gap cover. Gap cover is a short-term insurance product which can be purchased separately from your medical scheme and is an effective way to ensure that you are covered for hospital shortfalls. These shortfalls arise because there is no forced regulation on provider charges. Medical schemes may only cover up to a certain rand value, or your medical scheme has co-payments and deductibles. Gap cover will assist in covering the resultant in-hospital shortfalls. Please contact your NMG consultant to discuss the gap cover options available to you. Let's move to your chronic cover. All plans cover for medication relating to 27 chronic conditions which are paid from risk. Certain plans have an additional list of chronic conditions that will be covered, so it is important to understand this before you consider a plan change. By example, higher costing plans include cover for certain mental illnesses such as depression. A plan downgrade will result in the member having to pay for this medication from day-to-day benefits instead of the chronic benefit. Should you be diagnosed with a chronic condition, it is necessary for your doctor to contact the scheme to register your condition under the chronic benefit. This will ensure that your treatment and medication relating to the condition is covered by the scheme and will not affect your day-to-day benefits. Each plan has a chronic medication list, known as a formulary, to guide members on which medications are available on their plan. If you choose a medication that is not on the formulary, a co-payment may apply. Please chat to your doctor about the possibility of changing to a formulary medicine to avoid the shortfall. Bestmed members also have access to preventative care benefits, which entitles you to a number of screenings, preventative tests, and vaccines. Let's discuss day-to-day benefits. Bestmed offers a variety of options to meet members' different needs. They offer 2 hospital plans with no coverage for day-to-day benefits. If you choose a network plan, keep in mind that you'll be restricted to certain hospitals for elective procedures. There are 5 savings options that cover day-to-day expenses through an allocated savings account, as well as preventative dentistry through the preventative care benefit. It is important to remember that savings vary across plans and are calculated as a percentage of the member's annual contributions. Most Bestmed plans are classified as hybrid options, providing members with day-to-day coverage through a savings account along with extra day-to-day benefits up to specified limits. Network plans provide cover via network providers up to certain limits, and the contribution is based on income. Bestmed's maternity care program is available on all plans, including the following benefits: antenatal consultations, 2D scans, antenatal supplements, access to a 24-hour medical advice line, weekly emails with helpful tips about the pregnancy and baby developments. Partners also receive emails about baby developments and mom's progress, and a separate monitoring program for high-risk patients. You need to register on the Bestmed maternity care program as soon as your pregnancy has been confirmed. Now that you have a better understanding of the key components of your medical scheme, let's take a closer look at the options that are available. Here we provide a high-level summary of the PACE range with reference to the type of day-to-day cover, chronic cover, as well as principal member contributions. To summarize, all 4 options provide full hospitalization coverage at 100% of the Bestmed rate. The PACE range of plans cover medication for chronic conditions beyond the 27 prescribed minimum benefits. All 4 options combine savings and traditional benefits to cover day-to-day claims, and preventative benefits and a full maternity benefit are included in all PACE options. The BEAT range differentiates contributions between network and non-network options. It is important to consult with a representative to determine if the hospital networks align with the needs of you and your family before making any decisions. All BEAT options provide 100% hospitalization coverage at the Bestmed rate. 2 of the BEAT options cover medication for additional chronic conditions beyond the 27 prescribed minimum benefits. 3 of the options include a mix of savings and traditional benefits to cover day-to-day claims, with the exception of BEAT 1, which is a hospital plan only. Preventative benefits and comprehensive maternity benefits are included in all BEAT options. The Rhythm range offers budget-friendly, network-based plans where monthly contributions are linked to a member's income bracket. The Rhythm options include the following benefits accessed through network providers: unlimited GP consultations, basic dentistry, basic optometry, a specialist benefit, maternity and casualty benefits, prescribed medication, as well as a limited over-the-counter medication benefit. These plans are cost-effective and beneficial, provided members stay within the network. Bestmed offers a free wellness program called Tempo. As a Bestmed member, you have access to the Tempo benefits at no additional cost. By simply completing the Tempo lifestyle screening, The Tempo benefits will be activated, giving you access to over 1,000 healthcare professionals who are trained and motivated to help you improve your lifestyle and become the best version of yourself. The Tempo Lifestyle Screening is available for completion via the Tempo portal on the Bestmed app or website. The Tempo portal will allow members to track their physical activity, access virtual events, and information relating to nutrition, emotional well-being, and preventative care benefits. Let's take a look at the 2025 contributions. Note, the rhythm range are income banded plans. This means your contribution will be based on your gross monthly salary. Although we make every effort to get things right, there may be times when you feel that you have not received the level of service you are entitled to. The complaints procedure can be downloaded from www.nmg.co.za. Please reach out to your NMG consultant if you need any assistance with your plan choice.